Glad to be here this morning. As Matthew said, I've done a lot of talks, but I don't think any of them at 7 a.m. So glad to be here. Hopefully I've laid these sheets out here, just a one-page. What I'm trying to do here is summarize the 20,000 page law in one, which is nearly impossible. I don't miss your camera if I stand outside. Stand behind
I'll try to correct you.
First of all, you know, the healthcare law is very complex, very complicated. It affects everybody in some form or fashion. But the biggest thing with the law, it's really segregated from a business standpoint, is under 50 or over 50 employees. Okay, the law affects small businesses the most. I said that the most, or if I said 100% of the law affects small businesses, under 50, over 50, it only affects only 80% of the law affects businesses over 50. So that's a key point. Is where do you fall? And the law defines those employees as all employees. Part-time employees, full-time employees, seasonal employees. There's different definitions of employees and different definitions of numbers, so it gets really confusing. If we're talking about this part of the law, we're counting part-time and all employees. If we're talking about this law, we're talking about just full-time employees. So from that standpoint, it gets really confusing on, okay, what are we counting for this part of the law? Is it a full-time employee? Is it a part-time employee? Is it all employees? So that's where it gets confusing, especially if you're an employer that's in that range. If you're 45 to 50, or you're not sure how it affects you, you're right there. If you only have 10 employees, it's pretty simple. You're under 10. Or if you have 500 employees, well, you're over 500. So what I want to talk to you today about is really focusing in on how it affects small businesses, under 50, and individuals. Now the law in 2014 defines small business as 50. In 2016, it bumps it up to 100. So just to confuse things even further, in 2016 they changed the definition, and we start this whole process again. We're seeing, that's why I said you love the law, hate the law. I'm indifferent to it. It is the law, so just trying to explain to people, how it's going to affect them. But for small employers, so what I've tried to do is try to develop, one page, which is this, and I apologize for the font size, but in my effort to get it on one page, you have to use like size 9 font. I said I'll have to start using 11 by 17 paper because they keep on changing the law and doing everything else. But for small groups under 50 and individuals, the law mandates that they cover 10 essential health benefits, is what they call them, EHBs. So if you're a small employer or you're buying insurance on an individual basis, almost always, there are some outs if you're grandfathered, if you like your plan, you've better heard about that. But eventually everybody in that segment is going to have to buy a policy that covers those 10 essential health benefits. The government's mandated what those are. Most of our policies today cover the majority of those 10 essential health benefits. Where they don't, the biggest rub, I guess the two essential health benefits that have drawn the most attention are maternity coverage. Every plan, individual or small groups, got to cover maternity. So if I go out and buy an individual plan, I'm going to have maternity. I know I don't need it, but I'm going to pay for it to spread that cost over the masses. So that's been an issue for people on individual plans. Hey, I don't need maternity. Well, you got it, and you're going to pay for it. The other is pediatric vision and dental. So the law mandates that those plans cover children under the age of 19 for vision exams and materials, and a full-fledged dental plan. Your 2 cleanings, your bite-wing x-rays, all of those. So most of those, most people that have families covered will have the dental embedded in their medical plan. The rest of the essential benefits are stuff that always was already covered: inpatient hospital, outpatient hospital, prescription, mental health, emergency room, those type of things. Most policies already covered those procedures or benefits. So all those plans have to cover the 10 essential health benefits. whether you're on an individual plan or a small group plan. If you're over 50, you don't have to cover the 10 essential health benefits. So I wish they just would have applied it to everybody or nobody. But so if you're over 50, that requirement of the law doesn't apply. The next portion of the law is no pre-existing, which I think is a huge benefit. So if you've been uninsured, you can get insurance. They're going to cover your pre-existing conditions. Everything's guaranteed issue. That's helped a lot of people around town that I've met with that have been uninsured, that needed coverage and have coverage paid for. So that's part of the law. All of your co-pays, we talk about a lot of people don't understand. When they see insurance or they ask them how much an office visit costs, they always say, well, it's a $25 copay, or it's a $35 copay, or a $50 copay. All of your copays now accumulate towards your out-of-pocket maximum. In years past, copays were, it's a per occurrence fee that just went out into thin air. You never got any long-term accumulation. So now, if you're buying an Obamacare compliant plan, those office visit copays, your drug copays, your emergency room copay, all of those accumulate towards an out-of-pocket maximum. So once you really have a true out-of-pocket maximum under an Obamacare plan. Carriers, the restrictions on rating, it's no longer really risk-based. Insurance by nature is trying to manage risk, but health insurance with the laws really, the insurance companies can't rate on risk. They can only rate on 4 factors. In risk, medical conditions is not one of them. Age, they can rate on age. They can rate on family composition. They can rate on geographic location, and they can rate on tobacco usage. Now, the age restriction inside the law said they can only rate from the oldest to the youngest. It could be more than a 3-to-1 ratio based in that factor is what the 3-to-1 means on that list. Family composition, you'd pay for a husband, spouse, and up to 3 kids under the age of 20. So if you have 5 kids and 3 are under 20 and 2 are over 20, you're going to pay rates on everybody. My wife and I have 4 kids under 20, so we would pay for myself and her and our 3, and the 4th one would be free, so to speak. So that's what's part of the law. Geographic location, in the state of Tennessee, we have 8 regions, and rates are different per region. You have Hamilton, Bradley, Polk, this area is region 3, you got Knoxville's a region, Nashville's a region, East Tennessee's a region, West Tennessee, Memphis. So there's different rates depending on what region you're in. I've looked at all the rates. They're pretty close to the same. The region 3 rates for here are, on the bottom of the 8. They're not the most expensive. I think Memphis is most expensive, and then Nashville and Knoxville, and I think Chattanooga were in the middle or below from the cost curve standpoint. And tobacco usage, carriers, the law allows carriers to charge 1.5 times the premium for a non-tobacco person. Now, Blue Cross and Blue Shield, for example, is only charging about 16% above. So they can charge 50%, but they're only charging about 15 or 16%. And then the law also mandates that all of these, in addition to all those requirements, the insurance companies have to design plan designs that fall into these metal tiers. I'm sure you've probably heard that, but bronze, silver, gold, platinum. And what the law had indicated that bronze plans have to have what's called a 60% actuarial value, which means that those plans are expected to pay, on average, 60% of an average person's claims. Not your claims, not our claims, but a given population. And I'm not an actuary, but they pulled all this claims data from everywhere to fit these parameters. So insurance companies would then design a plan design with or without an office visit copay, deductible, out of pocket, those type of things. And then, okay, this plan meets 60%. The silver plan would meet 70%. The gold plan would meet 80%. The platinum plan would be 90%. So those all mandated. What we are seeing is that copays are pretty much a thing of the past. Now, as a result of the actuarial values, and as a result of the co-pays accumulating towards your out-of-pocket maximum. Now, there's still plans out there that offer the office visit copay. For example, Blue Cross offers roughly 50 different individual plans. 4 or 5 bronze plans, 16 silver plans, 11 gold plans, 4 platinum plans. Of those, probably 10 have an office visit copay and a drug card. The vast majority of them are straight deductible, co-insurance, and out-of-pocket. Okay, there's really 2 ways to purchase insurance if you're an individual or if you're a small business. Everybody's familiar with healthcare.gov. I would imagine you've heard that. We've coined that term, or the industry has, as on market. You're going to the marketplace, which is healthcare.gov, to buy insurance. The other would be off market, which you're circumventing that and just going directly with the carrier. The people that are going to healthcare.gov are those people that are going to receive what's called a premium assistance. Okay, the significant portion of this law, or the benefit of this law, are twofold on the marketplace plans. It's officially tabbed premium assistance. You've probably heard it called tax credit. Okay, but reduced premiums for those people that meet certain levels of federal poverty level. Okay, but officially it's called premium assistance. Everybody you hear, if you watch Fox News or you watch any of these other news, it's the tax credit. Okay, that's one portion. So people will get a reduced premium. The second is officially called cost sharing reduction, which is reduced deductibles, reduced out-of-pocket maximums for those people that are below 250% of the federal poverty level. Those two have helped a significant amount of people. Okay, and I'll give you some examples. But the law really says you'll pay premium based on your income. Okay, so being in the employee benefits, in the group market, in the individual market, I didn't need to know what people made to tell them what their best route was for health insurance. Well, now it becomes an integral part. If someone calls me and says, "Hey, I need insurance," okay, you're an individual, yes. Well, what's your income? What's your tax filing status? Because then I'm going to tell you we're going to go this way, or we're going to go this way. So what I've developed here, because I knew what federal poverty level was, but I didn't know exactly what the numbers were. Okay, so I had to develop this when I'm meeting with people, so I can give them an idea. Okay, if you're a single person, the law states that if you're between 100 and 400% of federal poverty level, you qualify for premium assistance. Okay, now in actuality, it's really probably 300% or below. Okay, as I've experienced it, and I'll kind of show you that. But as we look at this, the top graph shows you 0 to 400% of federal poverty level, and then a single filer, two person, 3 person, 4 person, 5 person, and where everybody stands. So it becomes a lot more complicated if you're a small business owner trying to figure out, are your people going to qualify for a tax credit, because you know what you're paying your employee, but you don't know what the spouse is making. So that's going to be an integral part for any small business owner, is how many of my people qualify for a tax credit. Because in simple terms, if my employees qualify for a tax credit, why do I want to spend my money when I can spend the federal government's money? It's just that's what the law is. So that's what we're looking at with small business owners. So these numbers are going to be for 2013, 2014. They're going to be a little bit higher, but 100% of federal poverty level for a single taxpayer is $11,490. So if you're making between $11,490 and $45,960, you're going to potentially qualify for premium assistance. Now, what the law says is, depending on where you fall under federal poverty level, it matches up with the second graph. You'll pay no more than a percentage of your income for insurance. So if you're at 400% of federal poverty level, or 300 to 400, it says you'll pay no more than 9.5% of your income for insurance. Those people probably are not getting a tax credit. Okay, so if I'm a single person and I'm making $45,000, I'm going to pay no more than 9.5%, that's basically $4,100. Well, I'm 42. The individual cost is probably going to be $2,100 for me. So that's below 9.5%. So even though I qualify from a federal poverty level, I don't qualify because my insurance rate is less than 9.5% of my income. So most of the people I ran into between 300 and 400% aren't getting a tax credit. Now, unless I was maybe 64, I may get a tax credit because now my insurance premium is based on my age, so it may be $7,000 a year, and I only got to pay $45. So it gets way complicated when we're talking about all that. So that's an integral part. I meet with people where you're at. This law benefits those people that are 100 to 250% of federal poverty level the most. Those single people making 17, 18, 20, $1,000, those people are qualifying for premium assistance and cost sharing reduction. I'll give you an example. I met with a lady who was 54, never had insurance before, is making $17,000, $18,000 a year. Her premium at 54 was $450 a month. But because her income was at 17, she qualified for a $350 premium credit. Okay, so the government's paying $350, she's going to pay $100. Okay, I can pay $100, she says. Okay, and then she also qualified for what's called cost sharing reduction. Now, to complicate things further, that tax credit is based on the second lowest cost silver plan. Okay, there's 16 silver plans. Okay, so that's your baseline. Your credit's based on that plan. You can take the credit and buy down, or take the credit and buy up. But you only get the cost sharing reduction if you buy a silver plan. Okay, so what we looked at is we looked at all the plans and looked at this silver 04, which is if a person qualifies for premium assistance and cost sharing reduction, the silver 04 plan is the best value. Now that plan, if I bought it on the open market, off market, no office visit copay, no drug card, you pay the first $2,000, 50% to $4,000 out of pocket. Okay, that's normal plan design. But since she qualified for cost sharing reduction, and there's 3 levels of cost sharing reduction, she qualified for the most. Her deductible was 0 under that plan design, and her out of pocket was $550. Okay, so she got $350 a month in premium assistance, and she's basically getting $3,500 in out of pocket assistance. She's loving it. That's a good plan for her. I wish I had that plan, but it was good for her. Okay, so that's how that can work. The hidden, people, and I'm running out of time, the law was originally passed with expanding Medicaid, or TennCare. The federal law in its original infancy, said, hey, we're going to pass this expanded Medicaid. We're going to offer that to anybody up to 138% of federal poverty level. Of course, the Supreme Court came back and said, hey, states don't have to do that. Tennessee, Alabama, Virginia. Most right-leaning states did not expand Medicaid, which I think was bad for businesses, probably good for taxpayers, but it's one of those, I don't know if it's right or wrong. But in the state of Tennessee, the people that are between 0 and 100% of federal poverty level are getting left behind. They're, for lack of a better term, they're getting hosed. They're not getting anything. Okay? So I thought the law was supposed to help those people the most. Well, those people aren't getting anything. Okay, so I met with a lady. She said, well, I only make $9,000 a year and I'm single. And I said, well, you're not going to qualify for a tax credit because you're below 100% of federal poverty level. You're not going to qualify for TennCare because the eligibility requirements won't allow you to be on just because you're making $9,000. So we can go off market and buy an individual plan. You just have to pay for it. Or you can make an extra $3,000 and get to 12 and qualify for a tax credit. Well, I'm not sure I can make another $3,000. I said, well, that's how law works, So it's interesting. The healthcare.gov enrollment site's working now in December. I've probably enrolled 50 individuals on healthcare.gov. I've probably enrolled 100 outside the exchange on the off-market plans. So it's certainly it's challenging. It's complicated. I don't know how people that have not bought insurance before are going to understand how all this tax credit works and how all this is going to work. And when you go to healthcare.gov, we didn't even get into plan designs. Why should I buy this plan versus that plan? The website's not actually giving you a fair comparison, in my opinion, for people to sit down and, okay, if I pay $300 for this or I pay $200 for this, and how's it work and what's my best option. So I'm running out of time. That's time for questions. I mean, we can talk all day about healthcare reform.
Question.
Yes, ma'am.
I went on the government website and I actually got a policy that I think is pretty good. I've always been denied insurance for migraine. Migraine medications run around $400 a month
Oh, yeah.
for 9 tablets.
Mm-hmm.
So I got my own insurance and now my office are covered for migraines, but they will not cover the medication because they're excluded medications. So is that a way of them getting around?
What they probably, obviously all carriers have what's called a formulary, what they're going to cover and what they're not going to cover. And they can, the law says they obviously can have formularies, but generally speaking, there's 2 or 3 different drugs that would be treated, and one of those would be covered, and one wouldn't be. I certainly would file an appeal, which if you bought it, we can help you. That's what part of the benefit of us is. We'd write up an appeal or a grievance with the insurance company, try to state the case, and that's why I say I kind of put my lawyer hat on, and I've got to write a brief to the insurance company appealing why they should cover that drug. But it's probably not on the formulary, or it requires some type of prior authorization based on cost. Hey, we want you to try this because it's more cost effective than starting at the top of the cost ladder. But that's a standard.
I actually have prescriptions for 3 different ones and it won't cover it.
Yeah. So, and that's what becomes a problem with insurance. You got to but they can still have a formulary. There's nothing that says they can't. Any other questions? Yes, sir.
As convoluted as this is, what is the likelihood, if we get a new Congress, that this will be completely repealed and we go back to the old way?
Slim to none,
Slim to none.
in my opinion. The issue is an affordability issue. Now, where's it going to be? If like this lady I told you about, she's getting about $7,000 to $8,000 in premium assistance here in Bradley County. That's one person. You multiply that times 10, 20 million people. My issue is where's the money coming from? I know we got plenty of money up there. The question is where are we spending it? That's what I'm concerned about is how are we going to fund this as a country if we get 10 or 15, 20 million people getting $8,000 in credit? But I don't know. We're 2 years out and see what happens in 2 years before anything happens, in my opinion. Yes.
You hear on the television about the mix of who's signing up and who's not signing up, and the question of the long-term viability. What's your sense of, because what I understand from what I've read and heard, younger, healthy people have to sign up because in effect they're going to subsidize through their premiums the older, sicker people, if that's the way it's characterized
Right.
anyway. What's your sense of how that's happening? Because I guess there's also this issue that some people got kicked off of their plans, and a lot of the people that are signing up are people who are signing up because they lost their old plan. Do you have any sense of who's signing up?
I think that's probably pretty accurate. You're having a hard time getting young people to sign up, young, healthy people. The majority of people I've signed up that are young had a pre-existing condition, signed up late, and needed to have heart surgery or heart transplant. I can't remember exactly what it was. She was all eager to sign up, but I can't get healthy people to sign up. So that's a problem, because they're going to say, it's just numbers. The penalty for going uninsured is $95 per adult or 1% of your income. So what they're looking at is, okay, my cost is $180 a month. My penalty is $9. It's pretty much not. It's not rocket science. They're saying, hey, I don't think that's a good value for me to spend $180 a month. I don't need it. So I think that's probably right on that they were having trouble getting young people sign up. Ty?
Is there much talk about how long the system can stand this negative selection? Because that's what you got.
Well, it is the ultimate adverse selection, is what it is. You got the sick people signing up almost at any cost. You got the healthy people at some cost saying, forget it. The system can't work that way. But that's where there's 5 or 6 fees. There's an insurance fee. There's a transition or reinsurance fee. There's all these taxes that are on businesses that are using to fund that adverse selection. So if Blue Cross gets adversely selected against, they get all the sick people. The reinsurance, transitional reinsurance fee, which starts in 2014 through 16, that money is supposed to be funneled to Blue Cross to offset that adverse selection. How all that's going to work, I don't know.
So what are the limits for small business where they have to start covering? I think
50,
50.
or you pay a shared responsibility, employer responsibility, $2,000 or $3,000 penalty per employee.
Is that the penalty for the small business?
No, it's under 50, there is no penalty.
Okay.
Michael, do you have a question?
But you said it's an affordability issue, isn't it also an access issue? I mean, you have, if we, in theory, we live in the greatest society in the world, and yet we still have people that don't have access to regular health care. In the flip side of this, you're actually having people to have the ability to be healthy for once in their lives, which will contribute to more productivity in the workplace, which will increase profits for companies, which will hopefully then trickle down supply side to allow the employer to pay for more coverage.
That's in theory, but it's kind of like when they changed the preventive services for 100%. Preventive services are paid at 100%. Annual well woman exam, annual physical exam, annual well child care. On a Obamacare plan, those are paid at 100%. That changed in 2010. The utilization that we see is the same or less. The people that were going are getting it free. The people that weren't going aren't going. The intent there was to get everybody to go get their annual physical exam, but just people aren't doing it. It wasn't a cost issue or an access issue. It was a time, effort, energy issue. But in theory, that's if people get insured and go, we'd have a healthier population. Here's another issue I wanted to bring up. I read an article in the Times Free Press. Blue Cross, competition's an issue. We only have Blue Cross. Blue Cross and Cigna on Marketplace are the only two carriers in our region, which is really just Blue Cross. Blue Cross offers 32 plans, Cigna offers 7. Blue Cross developed a new network called Network E. I would advise nobody to buy Network E. Take this and send it to Blue Cross. There's no access. But I read an article in the Times Free Press. You said Erlanger Blue Cross partnership good for Erlanger. They had 3,100 out of 6,000 signed up for Network E. The issue is it's an Erlanger-based network. They have 4 hospitals in the state: Erlanger, UT, St. Thomas, and Methodist. So they can only go to Erlanger. The other issue is physicians. There's no physicians in Bradley County that are in Network E. And I hadn't even looked at the ones in Hamilton County, but I would say there's very, very few. So those people now have insurance with Network E, but they have no access. Now, Network E, the prices are about 10% less expensive, so I can see why people are buying it, because it's 10% less expensive. But if you just paid 10% more on a $300 premium, it's $30 a month, now you have access to almost everybody in Network S. So I found that to be interesting. They're buying it, but they don't know what they're buying it, because when you go on there, it just says Silver 04E, Silver 04S. Well, same numbers, different letters. This one's 10%. I'll just buy that one. Well, what are you getting for it? And they're not getting very good access, in my opinion. So we'll continue at lunch. Anybody wants to come back?